Welcome again to another exciting episode. Before anything else, let me welcome my co host, James Genove, the Resistance Trader.
Hello, everyone. Good evening, good afternoon, good morning, wherever you are, whatever part of the world you're into. Mabuhay and welcome to the show. So, and again, we have a very exciting segment, sabi nga ni Fermin, of course. And thank you very much for having me again for this segment. And Happy New Year pa rin to everyone. Ayan. So, siguro, let's start introducing our guest, Sir Fermin. Very excited about this topic for
Yeah,
tonight,
let's
for today.
introduce. Right, let's introduce. So, one of our topic for tonight basically is blockchain disruptions in the healthcare industry. So,
Yeah,
as we know, blockchain is causing disruptions in a number of industries, but tonight our guest will be focusing primarily on the healthcare industry because that's where he's active. Brief introduction of our guest. He's a blockchain strategist, proponent, and visionary, a healthcare advocate, but a man of many talents. He's also a combat sports proponent. He has been at the forefront of driving social impact initiatives for more than 25 years and is also the Director of Business Development at ICOR BP, or the International Council of Registered Blockchain Professionals. So wag na natin patagalin pa, let's bring on board Doc Vince Vicente.
ayun. Hi, Doc Vince. Mabuhay. By the way, just for our audience benefit, no, our guest for today, for tonight, is none other than an international doctor, stateside, pero Pinoy na Pinoy. Ayan, Dr. Vince. Happy New Year, Doc. How are you?
Happy New Year to both of you. First and foremost, I would like to thank both of you for inviting me here. It's an honor, a pleasure, and sa audience ninyo, thank you for having me. And I'm so excited to have this kind of discussion. And para malaman ng audience na napakabait itong dalawang kaibigan natin. When I was there, they hosted me. A warm welcome. So for that, thank you. And sa lahat na nanonood, Happy New Year. Happy 2024. Bull 2024.
Agree. And ayan na nga, sabi ko sa inyo, very international,
Yun.
yet a local
Yun, boom.
flavor. Doctor. Diba?
O, sige Doc, umpisahan na natin. So,
Yes, sir.
what is the current state of the healthcare industry and what makes it candidate for blockchain?
So, yan. To
Let's see.
reiterate yung
What is
question natin,
uh,
yan. What is the current state of healthcare daw, Doc Vince? Na makes it an ideal candidate for blockchain.
ayun. The healthcare system ngayon, it's a mixed bag actually. Kasi there are things that are going on because of the pandemic. You have several medical breakthroughs. There's an increased access to technology. When I say increased access to technology, we have telehealth. Noon, 2017, nobody would believe us or when we started talking about telehealth, sabi na hindi pwede yun, malabo yun, maganda yung face to face. And then pandemic came, like, oh, suddenly people are using doctors are using telehealth, and with this that's where technology is heading. And it's not just telehealth. We are going into fourth industrial revolution, fifth industrial revolution, wherein we will involve the virtual reality, metaverse. So those are the things. Tapos other than that, there's a focus on preventive care, given the fact that we have the pandemic. Now people are so receptive on knowing ano bang things that we should do on our health that would prevent us from getting sick. So there's a change in lifestyle, preventive measures. And with regards to technology, people are trying to monitor their health status more advanced. If you try to look at yung ating Apple, iPad accessories, IoTs, wherein you could monitor your vital signs, even check your ECGs. So with regards to health, those are the things that are going on. But the only thing is, there are several challenges. Number one, high cost, talagang mahal. So since bago pa siya, and unequal access. When I say unequal access, yung mga mayayaman, middle income, those are the people who could easily access this. Pero yung mahihirap, wherein their focus is trying to make a living, hindi masyado. And we have an aging population. Yung mga anong tawag ito? Boomers. Napakarami ng aging population, and that's where the problem is in a way, because there's a growing demand for long-term care and management. So yung mga home health, senior facility, and the other thing is there's a shortage of healthcare workers. Lalo na dito, konti na lang mga doktor, konti na lang mga nurses, and the thing is with this shortage, uh, the healthcare system should do something to make sure na yung access ng mga patients would, hindi makakalimutan. And I think the other thing, yung challenge natin is data security. And it's just not on healthcare. Basically across the board. Now, when you say ideal candidate, why blockchain is an ideal candidate for healthcare? Because one, it increases yung data security and privacy, as we all know, cryptography. Tapos, once we have things in blockchain, streamlined na yung administrative processes, it would take out several layers of bureaucracy, mas mabilis, improve yung supply chain management, which later on we could discuss, kasi there are several fields wherein blockchain is very useful sa supply chain, lalo na sa pharmaceutical industry. And personalized medicine research, wherein blockchain, you can tokenize blockchain para you could share either, number one, yung digital identity mo, yung twin, genetic code, medical data, electronic medical research or records rather, and you could empower patients during tokenization. So yun, for me, those are the things that I think ang current state ng healthcare. On top of that, and why blockchain could address those challenges.
Okay, thank you very much for that insightful sharing, Dr. Vince. Siguro follow-up question lang ako. You mentioned about the data security. Same question under this question. A follow-up question would be, um, how how do you think can blockchain address the problem of security for the benefit of our audience? Because no, probably not everyone here watching us or listening to us right now might be well versed on the technology side of cryptocurrency and blockchain. So maybe it will have a very quick lang no na explainer. How can blockchain address those things that you mentioned?
Oh, data security. Your data is in the blockchain, it needs yung for the person who owns the data to have that private and public key. So nobody could ever access nandun yung binigay mo yung private key mo. I don't know how to explain this as much as simpler maybe you could help me out. And at the same time, private public key and your data is stored in a cryptographic manner. So not unless na you have the private key so that yung cryptographic manner pagka-store ng data mo, it can be uh, anong tawag ito? What would be the
Altered,
right term, James?
altered, cannot be altered. Parang ganun ba yun, Doc?
Oh, oo.
Yun, cannot
Oh,
be altered.
number one, it cannot be altered. But the thing is, they could access once you have that key. So from encrypt encryption of keys, encryption of data to decryption, you have those keys. And number two, nobody can alter because it's in a blockchain, it's immutable, it's decentralized. Nandun sa iba't ibang mga computer or nakalagay yung data mo. And for them to hack that data, they would have to hack all those anonymous computers na nandun yung database. So those are the things that for me makes it more secure. Nobody can just open your data. And once it is there, given that it's in a block, it's immutable. When you say nakataga na sa bato, you cannot change it. No, unless the only thing that you can do is amend the data, add more. But in terms
Yeah.
of changing it, you cannot do it. So I guess with that itself, and it's transparent. So hindi mo makita lahat, no? And makikita kung sinong nag-change if that happens, but it will never happen.
Okay. Thank you,
I
Doc
hope that
Vince.
helps.
Yeah, thank you, Doc Vince. Actually, very insightful yung sharing mo. So, ang ano ko na lang, let's having said that, no, that we have this security, we have this technology that actually helps us. The second question in relation to that, ito, second question na tayo. What do you think are the areas of healthcare where blockchain can add value? I mean, like
Mm,
you made mention of a lot of things, no? Na yung accessing ng data. A while ago, you were
yes.
talking about some new technology, etc., etc. That, well, di ba, kanina, we were talking about telehealth and everything. Now, what part of the healthcare industry do you think blockchain will be helpful?
That's a great question, James. There are several companies who are looking into it. And I think siguro it's more of looking at where the problem is and where blockchain can provide the solution. So what number one, ang nakikitang problema natin is medical records, the management of medical records. It's not that secure, minsan nahahack. So that's why we have security thing protocol that is with the blockchain so that it would help the security of our own medical records. So if you put it on blockchain, that would help us. And then several things. Ito, authenticity of records. One thing that I've noticed dun sa Pilipinas, pinakasimple lang, medical certificate. People tend,
Natawa tayong dalawa. Bakit tayo natawa? Kasi parang alam natin sa ginagamit yan, ano? Pagka gusto mo mag-leave bukas,
Oo, di ba? Yung medical
Ano,
certificate mo.
alam mo,
Ah,
sorry. Very, ano lang, for the benefit of our audience, no? Parang nagtama yung mata natin nung sinabi, medical certificate. Parang nagtama yung mata namin, sabay tayong tumawa kasi alam natin anong ginagawa ng mga Pilipino dyan.
oo. Ah, pupu nagtataka ang HR, they would call the doctors, "Doc, ba't ka nagbigay ng 1 week leave sa isang pasyente na migraine headache lang naman? Tapos paid leave pa 'to." And then titingnan ng doktor, hindi ko naman pirma 'to eh. That's not my signature. I did not order that." So, yun ang problema. There's falsification and the authenticity of that document is questionable. So what will blockchain do? It would help determine that kung merong binigay na medical certificate, it is authentic galing sa doktor. So once na-inisyo na ng doktor itong medical certificate, tapos it would be uploaded in the blockchain, it will be timestamped, it will have its QR code. Now, what happens is this QR code will be seen by the HR and they will scan it and they will know, okay, galing to sa doktor. Yeah, the patient visited this doctor, ito yung order niya. Nobody can hack it. You cannot even anong tawag ito, manipulate yung QR code. That's one thing. What does it do? It helps, number one, it helps the doctor's credibility. Hindi na masisira yung doktor. Kasi, number two, it helps the company a lot of money. It it saves a lot of money kasi, yung mga malingerers dyan, it's a paid leave. Di ba? So, it would prevent that from happening. And number three is yung records mo. You could still maintain those records and you can go anywhere actually as long as the facility that you will present that medical certificate or your medical records, immunization records or what, can access, mabigyan mo sila ng access and they can look at it. They will know who the doctor is, when it was issued, and those kinds of stuff. That's one medical certificate. Medical records is, for example, si Fermin pupunta ng Texas, something happens to him. What happens is, the doctors would call the
Nakonod yun,
Philippines.
nakonod. Nakonod tayo, something
No,
happens to me.
knock on wood. This is just an example. So, sabihin nila, we need the medical records. So what happens? It takes time for the facility to ask for those records, reaching out to people, and it takes time for the Philippine side to gather the medical records of a patient. But what happens if it's in the blockchain? Nandyan na yung medical record mo, dala-dala mo, nandyan yung private key mo. All you have to do is just let them scan sa QR code because nandyan sa blockchain and then it would come out, nandyan na yung records mo. It's available for anyone, for any doctor. But the good thing is, they cannot access it without your permission. Yun ang kagandahan dito sa electronic medical records sa blockchain. Now, let's go to supply chain management. Again, balik yung issue ng authenticity. One common problem, ngayon, there's a lot of fake medications, fake drugs. Prescription drugs, hindi yung illegal drugs. So, hindi natin alam kung saan sila nanggagaling. And then the question is, once doctors prescribe this to patients, sabihin ng generic, number one, it's either it's not working or mas maraming side effect. It's detrimental even to the patient. So it doesn't help. Knowing where the source of the medication from the manufacturer down to
Distribution.
distribution really helps on monitoring the authenticity of the product itself. Yun ang kagandahan ng blockchain because you cannot just manipulate those things and you can really trace back saan to galing. Galing ba to ng China? Galing ba ng Pakistan? India? or galing sa kuan, saan ba? Galing sa Davao.
Galing daw Eritrea. O, alam mo kung saan yan, Doc. Eritrea galing. Somewhere in
Oo.
Africa. Mm.
So those number two, yun ano, I talk about medical records. Then you have the supply chain. We still have at least two more if we have time. Clinical research. Clinical research usually, yun ang problema eh. Some of the data are being manipulated sa clinical research, and what we need is transparency and immutability of data. Now, once it's there, it's there. Nobody could take it out. Nobody could change it. Nobody could manipulate it. And ang kagandahan nito, kung nasa blockchain platform tayo, we can also tokenize the research study wherein it would incentivize the researchers to publish the research. Uh, ang nangyayari ngayon is like, okay, they publish it and they will look for somebody to fund the research or what. But if we have this kind of incentivization wherein the blockchain community itself would, help the researchers, I guess that would really help. And I guess the other
Siguro,
thing
Doc,
is,
yeah.
yes,
Siguro to take a stab on that, no, allow me to take a stab a little. Doon sa sinasabi mo na yung sa funding, it's very important kasi baka hindi for the benefit of our viewers, baka hindi nila masyadong naiintindihan. Those who will fund, for example, a private corporation who will fund the study, might be able to control the study itself, the the outcome, the data in, data out, which is detrimental if they have some business interest into it. You know what I mean? Unlike ng sinasabi ni Doc Vince na the crowdfunding, crowdsourcing nature of blockchain and crypto actually helps. So, yun yung ina-address nung kinukwento ni Doc Vince.
to,
Parang yes, I think to add to that, it's basically democratization of ownership.
Yun, no? Basta, very heavy term, no? Democratization. But yeah, it does. I think it's evening the playing field.
Tama.
mawawala na yung bureaucracy and vested interest because kung anyway, you already explained it, James, no? The other thing is yung secure data sharing. It securely shares yung anonymity ng medical data between researchers and the institutions. Yun ang kagandahan kung nasa blockchain platform. And it would really accelerate yung clinical research and drug
Pwede na
development
ako
with this kind of...
anonymous researcher without the risk of my identity being divulged to a
Yes.
kalabang pharmacy, for example. Di ba?
Oo.
Parang gano'n.
Hindi,
Oo.
hindi mo na kailangan i-dox. But because what is important is the result of the research itself. Now it's up to the researcher wherein he's willing to dox himself or not. But the thing is, with the anonymity of those data, not just the researcher, also the participants of the research, yung mga pasyente mismo.
Subjects, no? Yung mga subjects.
Oo, yung mga subject, yun ang kagandahan niya. Going to number 4, kasi we talk about electronic medical records, we talk about supply chain, na clinical research. The other thing is yung insurance, claims processing. PhilHealth sa atin, Medicare, or private insurances, because the problem with the current system is it takes time to claim an insurance, and there's a lot of still, again, those bureaucracy. There's fraud errors either from the hospital or the, I don't know, medical records to increase the claim. I'm not saying that it's lahat gumagawa, but there are times that these things are happening. There are several clinics way back then were investigated because of false claims. Patient na sabihin nila na, this patient has severe diabetes. or chronic illness or something, mas malaki yung bayad. Or sabihin na yung patient died of COVID, yun pala nabanggaan lang, secondary to trauma kasi mas malaking bayad ng COVID. I don't know. But the thing is, what's in the blockchain is it reduces errors and it secures claims. Um, it minimizes, ang kagandahan nito is it minimizes fraud and it makes things faster during the claims. I think there's a certain company who's doing a beta testing on insurance claim. It would just take a couple of minutes for the family to claim the insurance, life insurance uh, life insurance ng tao. So the beneficiaries, they would not be on a limbo waiting for the insurance to come because yung processes are already streamlined in blockchain. So faster yung settlements, medical insurance, life insurance, and all of those stuff. So I think those are the four main things. For now, we're in nasa healthcare, blockchain could really add value.
Thanks for those insights, Doc Vince. Now, I do have a question, diba? There are always two sides to a coin. So there will be people that will say that blockchain will not significantly help in all areas. So let's say for the healthcare industry, what are some of the areas where blockchain probably cannot provide any significant incremental value?
That's a very great question kasi in blockchain is not the magic pill. It's not an answer to everything. Na pagkita natin, oh, ito, I think blockchain will help this one. No. But before going to that, meron akong nakalimutan and I would like to add pala. I hope you won't mind in terms of healthcare and blockchain value.
Sure, go ahead.
I think public health surveillance during pandemic, yung surveillance monitoring ng patients who has COVID, that blockchain could really address that movement of people. Yun lang, there's a thin line between privacy, security, uh, personal autonomy, and monitoring. But I think with things going on in blockchain, given there is this anonymous thing, that could also help na, okay, merong certain person dito who has COVID or what, and then that would help in terms of data processing, no, real-time tracking of the disease. Number two is yung organ donor. It's like parang drugs din. You know kung saan nanggaling yung manufacturer. Organ donor, you know where the organ comes from and where you will look for if you have that on the blockchain. Mas mabilis.
Is it safe to say it also will avoid trafficking ng mga tao because of the organs?
Oh, yes, definitely. It would help it decrease, diminish illegal activities na yung donor harvesting. It sounds like a conspiracy theory, like, but I don't know, things are getting crazy nowadays, and those things might be or are happening. And with putting things into blockchain, you will know where it's coming from. It's done legally. And all the things, legal things, documentation are being processed. Yun ang kagandahan nito. And it cannot just be manipulated. So those are the things that nakalimutan ko that I add na I would like to address yung value ng blockchain. Now, the question of, are there areas where blockchain would not provide significant value? Meron ba? And what are these? And bakit? I think once you have a mature and well-regulated na data exchange system, for example, yung areas wherein na nagawa na ng national government, this adding of second layer thing, security sa blockchain would help, but it's not helpful or necessary at all because nandyan na yun eh. Nandyan na yung system. Personal data ng health with limited utility, I think that's also na hindi mo na kailangan. For example, daily caloric intake, sleep patterns, those things might be valuable sa individual, but it might not warrant yung security, complexibility, immutability ng blockchain, and it would cost a lot, not unless it will be tokenized because it would incentivize this person. Low complexity administrative task. For example, yung mga scheduling ng appointment, refilling ng prescription, hindi mo na kailangan ilagay sa blockchain yun. For example, patient, doc, yung patient will visit next time at this time of the day or month. Hindi naman kailangan yun ilagay sa blockchain eh. So, those basic scheduling, refilling ng prescription drugs, those are the things that it doesn't really need na mailagay sa blockchain. Data with a short lifespan, yung medical data with limited long-term value like lab results, chest x-rays, or for minor illnesses, I think personally, it doesn't justify yung storing those data and securing it in a blockchain because it would come out really expensive. Not unless na yun, you put an incentivization, tokenization aspect on those. And the other thing is, I think, yung areas wherein mababa yung digital literacy or internet access, because for populations with limited access to technology, it demands a lot of time, a lot of processing. Ayusin mo na nila yung foundation, ayusin mo na yung internet, ayusin mo na yung literacy na marunong sila magamit ng computer or even their cell phones before we could introduce blockchain, because blockchain is kind of more complex in such context, and I think it would be impractical. And the other things that we should consider is scalability. If it's scalable for a certain project or area, cost and complexity, and the last thing is regulations. I don't know, because regulation is still a gray zone. Though we're talking of cryptocurrencies, pwedeng talagang nandyan yung problema sa regulations. But in the blockchain space, it still needs legal framework clarity. So yun, I hope that helps.
Oh, certainly that helps because yun nga, you're right. We don't want people to think that blockchain is a magic bullet and it will solve everything. It can solve a lot of things, but as you said, there are certain tasks which simple automation can solve the problem without needing to go into the blockchain.
Opo, yeah, definitely. And it would just be costly for them, for us, if magagastos tayo doon. It doesn't, it's impractical to do so.
All right, thank you, Doc Vince, for that insightful sharing. No, siguro let's also, for the benefit of our audience, ask this question. Our next question is, given these examples that you made mention about the application of blockchain in healthcare, would you be aware of healthcare companies who are already using blockchain? May it be there abroad in the US or whatever part of the world. Meron ka
Yes.
na bang yan. O sige, please share more about it, Doc.
Ganito, I don't know which country, a specific country where they are working at, but what I know is there's several. So maybe pwede kung I could share at least 5 or 6, no? And then I could describe what kind of blockchain services that they offer. Number one is Medichain. Medichain We talk about this kanina, yung electronic medical records, yung company nito, it helps the healthcare provide and implement secure and tamper-proof na EMR. So everything is built in blockchain, and ang kagandahan nito, it allows for patients to have a greater control ng kanilang data, and it ensures that nobody can just open or look at their data without their permission. So yun, the health facility needs to authorize needs authorization coming from the patient before they could access, and MediChain facilitates that. um the other one is yung sa Estonia. As we all know, Estonia is a heavily blockchain country, and this company is called Guard Time. Ito yung cybersecurity na company ng Estonia. It offers blockchain-based solutions for protecting yung patient data, healthcare data. The other one is Chronicled. Ang Chronicled is a blockchain-based. Ito naman, it addresses the supply chain management for pharma industry. Now, I don't know which pharma industry that they're working with, but that's what they do. Na they're putting things into blockchain. So that's Chronicled. Uh, Avanir Health. That's the other thing. Other company that's using blockchain. This company uses blockchain to create secure, transparent na marketplace na naman for healthcare. So nasa point B sila sa receiving end, and making sure na this data, these products are coming from the right place, and it's immutable and transparent. And the last one is, there are several more, pero I think the last one on the top of my mind that I could share is Burst Q. This company uses blockchain to develop and secure yung interoperability platforms. So whether if it's whichever blockchain it's using, Ethereum based ba, BNB, Polygon, or what. So it's more of interoperability of the healthcare data. So once they transfer the data, walang hiccups, madali lang. So those are the different examples of companies. Again, MediChain, Guard Time, Chronicle, Avanir, Burst Q.
Yeah. Thank you, Doc Vince. Ano? Thank you for sharing this company. So, ayan, guys, you've heard from Doc Vince that there are already companies who are using blockchain, as he made mention, for the examples. Ayan. So, back to my partner, Sir Fermin. Are you there? Okay, I think Mr. Fermin is having some difficulty in terms of technical difficulty right now. So yeah, please pardon us about that. So siguro I'll be well, eto no, maybe we can wrap up our session, Doc Vince, right now with the question. Personal, we would like to hear your personal thoughts and opinion about this. What are the further blockchain developments you would like to see in in the medical industry, provided you yourself is a healthcare professional?
Let's go to the Philippines, or here in the States, or internationally.
Well,
If
overall, Doc, yeah, overall, you can fire it away.
okay, pinakasimple lang, adoption. People, hospitals, doctors, health practitioners, they would be able to at least adapt, understand what blockchain is and its applicability. Kasi without adoption, wala. Blockchain will never happen. And these are I guess, that's one of the choking points that personally I've experienced, lalo na sa Pilipinas. It's like you're offering a solution to a current problem, to solve what's going on, but there is still a kind of wag muna because I don't know what for whatever reason that may be. It's more of adoption. That's that coming from the heart. Kasi it's like we're pushing it. It's like trying to say believe Christ, accept Jesus Christ in your heart as your savior, and then people say whatever. So it's like preaching, being an advocate, and people literally listening to you because it helps the several systems, and yun nga, piling-pili lang din ang system, hindi naman magic bullet. On countries wherein blockchain is already there, yung interoperability, data sharing, those are the things that needs to be addressed with. And like I mentioned a while ago, there's this company who's already doing it, Burst IQ, wherein mas madali na ang transferring of data and data sharing. Patient empowerment, integration of blockchain para sa mga patients, lalo na sa controlled health records nila, they would allow their data, share their data. Ang kagandahan is, people, we are going to Web3 na ngayon, di ba? And Web3 is, hindi lang sa patient yan. It's, us being empowered. We own our data. So that's the thing. It's not just on healthcare, sa patients, but it's a growing trend. Supply chain management, more into supply chain because it would help the traceability of different pharmaceutical supply chains. It ensures the authenticity ng drugs, and it would reduce the risk of patient deaths or cost, and those untoward side effects of drugs that questionable kung saan sila nanggaling. Clinical trial research, there's not much talk about putting these things into blockchain. And like I said kanina, we mentioned kanina, with things going on wherein we tokenize community-based yung clinical research, I guess this would increase interest on researchers to really publicize their studies, and decreases yung vested interest of different big pharma companies. Credentials, licensings, licensures ng mga doctors or what, kung nakalagay sa blockchain, that would help. And on top of that, medical records. I think those are the things, that would really help. One thing pala, IoT integration. Because if things are integrated in the IoT, going to the blockchain, yung device, it could securely transmit and store the data coming from that device to the different medical devices, ensuring data integrity and privacy. And yun, medyo madami-dami na. Tokenization.
Maraming ask na wish list.
Maraming wish list. Pero number one wish
healthcare.
list lang, James, is adoption. I think we need adoption on this. And we need people like you, people like Fermin doing this broadcast, awareness, education, because this would help in the adoption process, educating people on what the technology is, what it can do, and where it would lead people to if we try to implement this or use this technology. So thank you to you guys. Without you, without doing this, matatagalan yung adoption natin.
No, I do agree that adoption is very important. And I think also going forward, not just for the healthcare industry, and James can also add later on, but I think even for other industries, it is not just greater adoption, but we have to find a way to make this adoption process simpler and easier to understand. Because until it becomes easy for people to use the technology, even if you can tell them this makes, for example, it will increase productivity by X%, make things quicker by X%, even if they want to adopt it, pero napakahirap intindihin, that will still be a barrier to having people adopt it. So I agree, adoption, and I think related to that is of adoption.
Yeah. I also want to add, Fermin, other than adoption, and James, going to the future of blockchain, um, yung IoT, NFT, and the metaverse, digital twin, because once we are into this technology, yung telehealth natin, it's not just the typical virtual Zoom calls, but it will be in the metaverse. And then it's easier to get the patient data when you are at the metaverse and VR, and we have our own avatars, and that's where the future is. Tapos even training the doctors, training residents in the metaverse on how to handle patients, simulations. Yun, the future is really bright, and for us, I think hindi lang yung nasa tech side, the visionaries, like we are so excited where it is heading. The only thing is, sana naman maintindihan, people would be able to understand and see what we are seeing, because this would help a lot. And adoption is where we are right now, and it's where it is needed.
Well said, well said. To our viewers, I trust you had a lot of nuggets of wisdom, great bits of information from Vince about the disruptions happening in healthcare, where they are now, and where he expects things to go. Bottom line is be prepared for further improvements going forward, not just in healthcare, but even in other industries as the blockchain continues to thrive and cause disruptions in more industries. James?
Yes, and yeah, very very insightful session with, of course, our good friend Dr. Vince. And again, we would like to thank Doc Vince for sharing his knowledge to us again, also to our viewers right now. Maraming maraming salamat sa mga nanonood sa atin, nakikinig sa atin in our weekly show. It is them that we are, it is for them rather that we are doing the show. Yeah. Thank you, thank you, thank you.
So, with that, on behalf of Museigen and the Resistance Trader, thank you for taking time from your busy schedule to share your insights. To the viewers, thank you also for taking time from your day to join us. And we look forward to seeing you at our next podcast. In the meantime, bye for now.
Yeah. See you again next time.